as I was just saying in the read into you, the pandemic has shed a huge spotlight on the power and the potential of biotech and biopharma. How has this spotlight, this attention, translated into investor appetite for the healthcare sector?
Good morning, and it's great to be here to discuss this with you. What we found in our report is that investment into healthcare has really accelerated across all subsectors. We looked at biotech, we looked at health tech, medical device, and tools and diagnostics as well. And as you said in your introduction, the first half of 2020 has pretty much matched the whole of 2020's investment pace. Overall, about 50 billion or so in investment going in. And it's, the pandemic has been partly responsible for this. As you say, it's shone a spotlight into the sector. It's created demand for, for drugs, for treatments, and for alternative care models as well. Interestingly, the one sector that really outperformed amongst the tall poppies was health tech, the only sector actually that in the first half of 2021 has outperformed its figures for the whole of 2020, with investment coming in at about 15 billion at the half-year mark compared to 10 billion for the whole of 2020.
What kind of growth are investors expecting from health tech, and what's the investment horizon that those who might be interested in getting involved in health tech should be thinking about?
Yeah, these are largely investments made by venture capital firms, so they're looking to a medium to long-term horizon. And a lot of health tech investment is going into alternative care and provider operations as well. And you're typically selling into established healthcare systems. Unlike perhaps in some areas of software where you can sort of disrupt from the outside and build an alternative ecosystem, within health tech, you really have to work with it within the ecosystem. So the timescales are going to be longer in many respects. But one thing we've seen in things like hybrid care and alternative care is that when you have a disruptive state of affairs like the pandemic, it can greatly accelerate some subsectors. So we've seen, large employers, for example, including alternative care benefits as part of their health programs, as part of their insurance programs. And that's greatly accelerated the change in business models in some of these sectors.